Welcome back, you all, to CHD 210, Educating Exceptional Children. This week, we are going to cover Chapter 12, entitled Meal Times. One of the things we want to make sure is we realize is that meal times are an essential component of an early childhood program. Most early childhood programs serve at least a snack during a specific time each day. Some also serve breakfast, possibly lunch, and then some may provide that mid-morning snack, then lunch. If the program is an afternoon or after-school type program, they may typically serve that mid-morning snack, lunch, that mid-afternoon snack. And then if it's a center that keeps children 24 hours, they may even bring in that dinner. So it's a big piece of the curriculum, and children with special needs often have specific dietary issues. They may have some allergies or some food phobias. They may bring their own snacks and food. So it's a piece that we really need to understand how to deal with, not only with typical children, but also with special needs or atypically developing children. So let's get going. Children with special needs can gain a great sense of accomplishment by learning self-help and social skills related to mealtime. So we're going to talk a little bit about learning opportunities that can occur during these snack and meal times. Now, a few things that your book talks about are self-feeding skills, as well as like self-help skills. And we know that anytime we talked about in a couple of our other chapters, or maybe in some of our other courses, about family style meals where the children are all seated together, you're passing foods. There's a lot of social interaction that goes on during this time too. So not only are we talking about self-feeding skills and self-help skills, but we're also talking about developing social skills like passing food, helping oneself to a single serving, like not serving themselves too much, waiting your turn, asking for someone to pass you something, waiting to be excused from the table, just those basic social skills that we need to teach children. And also communication, where they're learning to talk with their friends, and what type of voice we use, like our inside voices that we use while at the table. The vocabulary associated with it as well is a big piece of the communication. But let's talk a second about developing self-feeding skills. So what are we talking about here? We want to teach them how to learn how to eat with utensils, discriminate which foods need utensils and which do not, drink from a cup, all of those types of things. So those are self-feeding skills that children need to understand how to do. So we want them to, when we're talking about special needs children, we're really trying to incorporate those self-feeding skills with those that can into the meal time. So we want to make sure that the special needs child is sitting next to or in front of an adult so that they can help facilitate this self-feeding. We want to use any type of adapted utensils or dishes that they may need. And also we want to kind of self-analyze or task analyze their skills, like eating with a spoon. Remember we talked about task analysis last time, a few chapters ago. So we might want to teach them like in using a spoon. So we want to show them as well as tell them, you know, and give them specific, like grasp the spoon firmly, rotate their wrist in order to get the spoon into, you know, the food into the spoon, open their mouth, you know, those types of things. So we want to really make sure we break those skills down for them. Now, sometimes there will be children where adult fed strategies must occur, like children that cannot feed themselves, okay? Maybe they have a severe medical or motor disability that prevents them from actually being able to feed themselves, so therefore they must be fed by an adult. In a school system setting, these children are probably going to be accompanied by a one-to-one assistant who's going to perform this function. But if this is not the case, then the early childhood teacher is going to have to make sure they do the things that you see in front of you. Work closely with the family or a specialist who's going to provide you with specific feeding techniques, including how to properly position them, and also how to use adapted or specifically designed utensils or dishes for them. If you are looking in your textbook, you'll see several pictures as you go through the chapter of adapted or specifically designed utensils or dishes that make it easier for this adult feeding to happen. So how do we transition children? Sometimes special needs children, they have a harder time transitioning in and out of different activities or in and out of mealtime. So we want to make sure that we follow a sequence of events when we're doing this. Maybe, offering them lots of assistance and then gradually reducing the assistance that we give them is a pretty good strategy. But these are the things that you want to do. Now, what's interesting to me is that when we're talking about this, of course, this course is about working with children with special needs. However, when I look at this mealtime strategy suggestion, I think these are great things to do with all children. So we're going to warn them of the impending transition. So we might say something like, it's time to eat in 2 minutes, so we're going to get ready, that kind of thing. Just giving them that warning so they know, okay, I've got to clean up from what I'm doing so that we can transition into something else. Of course, any good teacher does this, not just at mealtime, but between all activities in the classroom. We might sing the same song to signal the beginning of the transition. I think about cleanup songs here, like we give them a bag, we sing that same song which says, clean up, everybody clean up. Where we're singing the same song lets them know, okay, well, I got to start cleaning up because we're about to be moving on to something else. And then, of course, as it is with anything, we want to make sure we follow that set routine. Come inside, sing the song, set the table, wash your hands, find a seat. I mean, like every day we do it the same exact way. All right, so let's talk about some special considerations in dealing with children with special needs. Sometimes, depending on the disability, there may be some specific nutritional needs or challenges that may come along with it. We know children with cerebral palsy, sometimes their food intake is often decreased due to like their tongue thrust, meaning protruding the tongue forward. They can't close their lips, like poor lip closure. Something called a tonic bite reflex, which means that they vigorously clamp their teeth down when the mouth is stimulated in a certain way. So like if food were to get it, they might automatically just clench their teeth very tightly, okay? Or sometimes something even called an abnormal gag reflex. Sometimes this can be exaggerated and sometimes this can be weak. And children with cerebral palsy, most often they need a softer type food. So you'll see like they might do better with sweet potatoes, mashed beans, spreads like jams or whatever made with real fruit. So those are some things that could take into consideration with children with cerebral palsy. The next thing I want to talk to you about is children with low muscle tone. A lot of time we associate low muscle tone with children who have Down syndrome. And so table eating or self-feeding can often be delayed because of a low muscle tone. And the reason is that if they have a low muscle tone, they may have difficulty receiving adequate oral sensation or maintaining adequate muscle tension with their mouths, lips, or tongues. And often this is related to maybe like excessive drooling. You may have seen that. And so children, because of that, may not realize where the food or liquid is actually in their mouth and may not even realize that their mouths are full. which can, you know, those types of results might lead to an increase in choking. So we really may want to make sure that we're watching children who may have that low muscle tone a little bit more carefully during mealtime. Children with pica, this is kind of a rare thing. You may have seen this on television too, that Obsession show. But typically these folks, our children develops when they obsess over eating non-food items like dirt or paint. So certainly something we might want to make sure we're watching for in our classrooms. And you know, if we see that children might appear like maybe to crave these non-food substances, we definitely want to make sure that we report that to the director or the school nurse, the building principal, so that they can get you or their parent in touch with like nutritionists who are knowledgeable about these types of things regarding children with special needs and can help the parent and also help the teacher in how to deal with these if this were to occur in your classroom. All right, one thing too I want to point out to you is about culture or diversity awareness. Culture certainly affects the eating habits and food preferences of children. It may also influence the beliefs about nutritional value and the appeal to food. So you will become aware of the cultural preferences of families and what to serve at mealtime, but also remember you need to always consider the health considerations for all children, okay? Consider children who are lactose intolerant, you know. If the child if they're lactose intolerant, they must avoid any product that has milk or dairy products in it. Children with diabetes must have special consideration given to the amount and types of carbohydrates they eat. So, you know, we want to make sure that we stay up to date and consult our families so that we're making sure that we're meeting any of these diversity type things or special considerations. Okay, that does chapter 12, meal times, and I will see you next week.